Today, in Docplexus series of interviews, we have with us Professor Dr. Jonathan Berek. He is Laurie Kraus, Professor and Chair at Department of OBGYN at Stanford University. He's also past president in International Gynaecological Cancer Society and past president Council University Chairs OBGYN. Thank you very much, Dr. Jonathan Berek, for your time today in this busy schedule. So what I would like to ask you is, what are the major challenges for gynecologists generally when they face any gynecological oncology challenge?
Well, most general gynecologists are not trained sufficiently well to take care of all of the gynecologic cancers. Because it's a very sophisticated subspecialty. And in many parts of the world, there are subspecialty training programs. So in order for the gynecologist to become facile with being able to take care of gynecologic malignancy, it really requires additional training. And so what's promoted around the world is the development of fellowship training programs. So those individuals who are very interested in pursuing a career in gynecologic malignancy should seek those training programs. And in India, I know that those programs are being developed and expanded over time. It's always challenging to get them going, but that's the sort of thing that needs to be supported by the profession in order to improve the quality of cancer care throughout the country. There are many qualified people, physicians and surgeons, who take care of gynecologic cancer in India, many qualified. And so in order to go forward, though, and expand the number of physicians available to treat gynecologic cancer, they need to further expand the training programs, fellowship training programs in gynecologic cancer. In general, that's done at the end of a training in general obstetrics and gynecology, and then usually spend a few more years doing specialized training. Mm-hmm.
Okay, so I would like to ask you a second and last question, because I know you're running late today. So what are the recent practice-changing breakthroughs in the field of gynecological oncology you would like to highlight?
Well, I think one of the most important observations was just a little over 20 years ago when the BRCA1 gene was discovered, because we now have a way of understanding the familial and genetic transmission that put women at risk for the development of ovarian, fallopian tube, and peritoneal cancer, as well as breast cancer. And of course, since then, BRCA2 was discovered, and many other low penetrance genes that may increase the risk slightly, but not as high as the high penetrance genes, that is, the genes that are very likely to result in the transmission of the probability of getting one of those cancers. So if you can test someone for that, then you have a chance to prevent the disease by, in this case, removing the fallopian tubes and the ovaries as appropriate. And in some women, they even have prophylactic mastectomies or more intense screening to try to catch tumors earlier. So this is a very important discovery, and the whole field of genetics is moving so quickly now in women's cancers in general, breast and gynecologic cancer, and that's the huge breakthrough. And also the technology available for testing women is becoming less expensive, and so more and more women are being tested, and therefore more and more women will have the ability to understand that they are at risk and can do something about it. It's life-saving when that's done. So that's really one of the main things. The other thing that's very critical to highlight is the development of the cervical cancer vaccine, the HPV vaccine, because that has the potential to dramatically decrease over time, hopefully, not only the risk of pre-invasive disease, but ultimately prevent the invasive cancer. So as we need to get more and more people vaccinated, both young girls and boys, so that we have the opportunity over the coming decades to decrease substantially not only the incidence of the disease, but the probability that people are going to die from the disease. So those are probably two of the major highlights. Another area that's important to highlight very quickly is the advent of more minimally invasive surgery and oncologic surgery. For example, we now have robotic surgery or a lot of endoscopic surgery with laparoscopy. And most of the large centers are now doing a lot of their radical hysterectomies and extended hysterectomies and lymphadenectomies with the help of the robot. And it's just another tool, but the advantage is, because it's, quote, minimally invasive, is that patients can get out of the hospital more quickly, so it reduces morbidity, the cost, et cetera, and the outcomes are equivalent otherwise, so in terms of survival and cure. So those are probably three of the most important things. As we get more and more molecular evidence for all these diseases, we'll over time be able to probably categorize them better and design treatments. So in the area of ovarian cancer, for example, there are a whole host of new drugs that are being developed, some of which can be actually taken orally. We've seen over the past several decades the reduction in the difficulty taking chemotherapy. People can take it easier, there's better amelioration of the side effects, and so people are living longer and living better, even with advanced ovarian cancer.
Thank you very much, Dr. Berek.
Pleasure.